All right, so Matt, appreciate you being on, dude. I think I want to. So there's a bunch of places that we're going to go over the course of this conversation, and we'll kind of let that naturally kind of take us wherever we go. But I want to start in the world of collegiate hockey, because obviously when you think about the University of Denver, like people think about like the world of college hockey, and for good reason, right? And I think the first question is, you've been there for a while, you've gotten to see first of all multiple national championships, which is incredible, but you've seen a huge spectrum of good players, great players, incredible athletes. So can you just talk about, from a hockey perspective, just the difference you've seen in physical capacity between these good players, these okay players, and these really incredibly great players? And if I'm just trying to like reach for answers here, like you can say that for sure, but what have you noticed over the course of your time there?
Yeah, it's really interesting. I mean, like even at the pro level, I mean, there can be such a wide spectrum of one, even just like body types. Like you could have somebody as short as 5'8", 5'9", who's exceptionally talented and skilled at the elite level. And then somebody who's also 6'5". And the size discrepancy, I mean, I think is unique to hockey. How people express themselves on the ice, is unique in that it's not a running and traditional sport. It's a completely different mode of locomotion, which obviously has its complexity within how people are moving and then long term how they're evolving orthopedically within that sport. But I think the interesting thing about how people succeed within the sport, right, is this like really unique intersection between skill with their hands, their execution and technical ability of skating, and then the physical development side and their ability to manipulate center of mass, balance, and their relative force output. So I think that what we've seen, right, is that like you can get to the next level, and be an elite hockey player, through, I think, a lot of different means. Some people lend themselves more on the really high talent and skill execution, um, line of development. And then I've also seen people make it, through just pure physical ability, who might not be, the most technical of skaters or the most skilled with their hands, but what they bring to the game is unique and different. So I think, people's ability to make it to the next level really is like defining their role within the sport. And hockey's unique in that, you could have somebody who's literally contributing behind their team as maybe a fighter or enforcer, all the way to a shutdown defensive defenseman, or it could be an offensive defenseman, who lends themselves more on the offensive end, even though their primary responsibility obviously is defense. And then it's really unique demands within the sport. So it's hard to kind of pinpoint, but I think it's that unique intersection between, like I said, someone's ability to manipulate their body, generate a huge amount of force, and then being able to express that uniquely on the ice, and with their stick in hand.
It's really interesting to think about the sports, especially within the like profession that we work in, that feel as though we can make a bigger impact in. It's kind of like a spectrum. One sports that I feel like have just like a big skill component to where it's like we're not really affecting skill too much, and then there's other sports that have, if you're a freak, you're probably going to be pretty good. Where do you think hockey falls on that spectrum? Like, I think on one end, like people can talk about there's a huge technical and mental component to football, but if you're a defensive end and you're huge, fast, strong, like you could probably make an impact on the field. All the way to the other end of, I don't know if we want to talk about golf or some baseball positions. Like, I don't know, there's a huge skill component there. Where do you think hockey falls on that spectrum?
Yeah, I don't think you're going to find many like John Daly's on the ice where it's like
Yeah.
they physically just completely have let themselves go, but then can express. There probably are individual, I think, examples of that, but, I think where the NHL is now in pro hockey, you're going to find really good athletes. But I think the thing that gets people to the next level, right, is that skill behind what they can do with a stick or how they can skate and move on the ice. Um, but like I said, it's really interesting to see the difference in body type. Like I've had guys that literally upwards of 6'5", 6'6", and then another kid who I'm working with who's 5'6", and they can both be elite level players. But it's about, I think, the demand within their position and just the spectrum of those sides. But I think when you look at the next level, physical development is always going to be a huge part of that process. But I think that there's always really interesting ends behind the physical development piece. But to me, like the biggest impact that we can make is how people move, and that manipulation of center of mass on the ice, because it is a very like open and free sport. You're dealing with low friction on the ice. You're dealing with a huge amount of manipulation of balance. You're playing on an eighth of an inch of a blade. And it's about your ability to, I think, creatively reposition your body in a moment, in a split second, and either generate a pass or a shot, or do things defensively to keep yourself in the correct position and angling. And so I just think it is a very high skill sport, but skating is so unique in that you have to be able to skate at the next level, that I think you're going to find a lot more people that are on the higher end of skill level with like skating than not.
So with skating specifically, and I've spent some time like looking into this, is like, what are like the off ice markers that would potentially predict on ice skating ability? And if you look through like the research in the world of performance as it relates to on ice skating, it's like incredibly contradictory. Like there are some studies that say like, oh, off ice speed development equates to on ice speed development. There are some that say it doesn't at all. There's some that say like horizontal power correlates to on ice. Some say it's vertical power. Like there's a ton of contradiction within that world of how does off ice training relate to specifically on ice skating ability. So when you talk about the idea of like some of our goals are to help our athletes manipulate like center of mass, give them this huge movement library, like where do you start with a team is a huge broad question. Like how do you start with a team and thinking about, okay, if my goal is this manipulation of center of mass, which is not necessarily like maybe a goal you think about for a lot of other sports, how do you think about then structuring program around that fairly specific goal?
Yeah, I mean, I think, but to your point, like you can't isolate single factors because it is so multifactorial. Like you can have somebody who's a very average skater who can generate a huge amount of force and they can be a relatively successful skater on the ice. And then you could also have the opposite, a kid who doesn't generate a ton of force, but who's so good on their edges and they can just move and glide differently and show efficiency on the ice differently. So I think that's also the complexity within the sport, is just the on ice skating technique side. So for us, like the way that we look at it and the biggest things that we go after is, I always think of like Bondarchuk's classification system. It's like we really do go from general to specific across an off-season period. One, because our guys need a break from skating, and it's kind of almost naturally built into our schedule here because we actually take the ice out at the end of the season. We run about 26 graduations at the end of our academic year for local high schools. And so it's kind of a good thing, but we shut down on ice for about 4 to 5 weeks during that period of time. And we just get back into foundational, like global prerequisites, right? Can someone squat, lunge? Can they push, pull, lower body, upper body? Can they get back into generalized movement and away from the hip stress and demand of their sport and the specificity of the amount of stress that's going through that lumbopelvic hip complex? And then as the summer goes on, it's like we build into off-ice conditioning, off-ice speed work, and then we start to blend that naturally back onto the ice through midsummer. But the thing that we've kind of really, I think, targeted over the last few years is how we blend general work into specific work, especially ahead of preseason. The unique side of college hockey is that we're dealing with a sport that has like the longest collegiate season running from October 1st through mid-April. And we have a very, very short preseason period. It's mandated that at the NCAA level that all of the teams can begin preseason around mid-September. We're kind of in that same situation in that we run into the issue of we're on the quarter system. And so our classes don't even begin till mid-September. So everything that's done prior to that is voluntary. And so our guys' ability to run captain's practices or skill work in the off season, or what we're structuring from, the sports performance side and programming in across the off season period voluntarily, really is helping to create that natural blended path of going from general to specific, and making sure that we're handling on ice loads and progressions going into that preseason period. So it's not like a massive acute change in physical stress. So I think even things like off ice speed development, we run pretty heavily, especially on the front half of the off season, but then it does blend into on ice speed work and acceleration work, top end speed exposure, and agility, deceleration work, off ice to on ice. Fitness goes from off ice to on ice. And so it's having this very like natural progression across tissue and across cardiovascular stress that gets into very specific ranges of motion. And so the things that we look for, right, is like, how well are we matching up range of motion, impulse? So how much, the difference between length of time that it takes a hockey player to generate force, especially within their stride, which might be almost twice or three times the length of that of running, as it's a very non-elastic stride. So those things are always in the back of our head in terms of development, and it's our ability to kind of make sure that we're getting into ranges of motion, especially for these guys that I think in the front half of the summer in a general sense, but then getting into it very specifically in mid and towards that end of the summer related to what they're going to see on the ice.
I have a question about the like more specific period of the year, but I want to rewind back to that early off-season point. And one of the
Yeah.
things that I saw a lot on some of like the things that you would post on social media when I was just like doing some prep for this episode was the glute iso series. And I think it ties in well to the lumbopelvic portion that you were mentioning. And background on me, I was a GA at Minnesota State Mankato. And in the state of Minnesota, everybody is just like a Cal Dietz disciple, it seems like. And he has a glute layering series, and seeing it looked similar. Is that similar concepts? I'm assuming it's similar-ish.
Yeah, so all of that was derived. So years ago, I hired Matt Van Dyke, right? And Matt and I both were, Matt came in from University of Minnesota and as a grad assistant at St. Cloud. But we attended FNOR, which is Functional Neuro-Orthopedic Rehabilitation. And we had a unbelievable opportunity of a local practitioner. He's a chiropractor by trade, but he's also a Gray Institute fellow. So this goes back almost 13, 14 years ago when I was introduced to him when I first moved out here with men's soccer at the time. And Dr. Studholm was one of the lead educators behind FNOR. And there's some really brilliant chiropractic practitioners that built out an education system. And a lot of that, the foundations were built out of neuroplasticity and looked at research behind people that have suffered stroke and the rehab process and coming back from those things. So it is taking a neuromuscular rehab approach. But what you find, right, is like when you start getting into long duration isometrics and remodeling someone's ability to, I think, create dominant patterns and altering really like that pre-motor cortex within the brain and how things are kind of getting established. It goes from a very general sense of like tissue adaptation to then it's almost like reestablishing, I think, an approach within your brain subconsciously that like your hip should be the main driver. So there's almost like similar principles behind RPR or other crossovers and other methods, but we want to teach our guys that the primary driver of hip should be around your glute. And whether that's abduction, external rotation, or hip extension, it's not compensation patterns that are happening around your QL or in peripheral zones, right? And RPR does a great job, I think, of establishing that in the education system behind how people can compensate. But if you start to layer those things in and, we get upwards of, I think it's right around 15 minutes of different, very specific positional isometrics. And that's our lead in of every off season. So we go through 15 minutes roughly before every single lift across the first 2.5 weeks of training. And that is literally our built-in warm-up. And then from there, then they go into different circuits. And we've done we almost blend things from, I think of almost like Todd Wright's work and what he's done on like a 3-dimensional like locomotion period. We've done, things like extensive plyometrics and setting the foundation there from like lower shank and then also hip dominant, like just generalized extensive jumping. But then it goes into these circuits that have very specific, I think, targets behind tissue adaptation. So, we've basically 3D'd the living heck out of Cal's original GPP phase. So things like Sandbell, or we basically just take a 5 or a 10-pound plate and have guys go through really extensive, high repetition, complex movement where it's like they lunge, they push, they pull. But it is like very heavily 3-dimensional, total body, and it's putting them into very specific ranges of motion. And it's reestablishing those global patterns of can they lunge, can they squat, can they hinge, can they push, can they pull, and can they make their hip their primary driver during every single one of those movements. And then we might do the same thing with contralateral exercises in a circuit. But then we still do things like 1x20, or even like an ISO like circuit where we're getting into end range, and having guys express submax loads and being able to reestablish work capacity during that period while we're trying to basically layer in that glute ISO series and setting the foundation around their hip girdle coming off the season.
For some reason, I just love the early off season and the qualities that are trying to establish. And I think it's probably because the in season period is so long and monotonous that like once you get to the early off season, it's just like a reset of training principles. And I don't know how many pieces there are to it. So if it's a ton, maybe you can, I don't know, shave it down or give us a broad, but I would be interested to hear about like the specific positions for this glute ISO series that you're hitting and maybe the progression, because I saw there's like a isometric portion and then it also transitions to a dynamic portion. Can you just talk about the specifics of the ISO series?
Yeah, so the ISO series, like I said, is roughly about 15 minutes. And actually, I will preface this by saying this will be getting released on Alex Natera's Bite Size Performance Solutions probably within the next few months. But really what it is it's getting people into, we actually start like, they take a full week off right following the season, and then during that second week, especially in the back half of that week, usually that will institute the first 2 exposures of this. So we kind of like have like a very partial like lead in after the season where guys just voluntarily come in, they crank it out, and guys like want to do it, right? They get stir crazy. We're not taking 2 to 3 weeks off or they're just detraining during that period. But they come in, we basically stretch their hip flexors. We want to run like reciprocal inhibition and get length put back into the front side of the tissue. Then we will go in and we run a series of 30 seconds in the first like kind of half week, and then it builds up to a minute. And then once we get to a minute, it's basically a full week at a minute of static end range isometrics where the glute is put into the 3 different main positions of abduction, external rotation, and hip extension. And we try to find the most regressed positions possible to eliminate compensation out of paraspinal involvement. So we will literally manually go in, and while they're running like banded isometrics, and it's usually a very light band to help prevent compensation, we will literally manually touch their paraspinals or get the athletes in a position where like, can they feel their paraspinal engagement, and teach them to shut off anything that is peripheral to their glute. So if you find an athlete who's co-contracting in their lumbar and their paraspinals or their hamstrings or their quads to try to go back into their hip in an isolated position, we teach them out of those positions. We want them to basically shut off every other tissue line except for the one thing at their hip and at their glute. But end range of abduction, we will hit in both like a short and in a long position. Same thing with external rotation. So it's like we'll also manipulate range of motion. For the most part, the band is above the knee line, but we want to find tissue lengths that are in stretch. So when the hip is in flexion, as well as when the hip is in extension and the tissue is in a contracted or shortened state. And then, like to your point, in that second week, we start that entire first week in a very static position. And we, even by the end of that first week, you can see a noticeable difference in an athlete's ability to, I think, understand the position and manipulation of their hip, and finding a little bit more posterior tilt, getting things into an organized position to maximize hip involvement. But then by that second week, we actually start to manipulate. It's almost like isodynamics. So we run a 2-second hold at their max end range, just shy of where they're going to compensate. And then we have them go into mid range. And then that second week is all about creating more variability within positions and more dynamic approaches where basically your brain and your prefrontal cortex are establishing a greater, I think, understanding of how to utilize your glute within context. But that's also being provided, like I said, and it's stacked and layered with what we're doing from like a general physical prep, and like the normalized like training and circuit work that we're doing as well.
So brief follow-up here is, I imagine like hockey players, you look at injury reports across the country for hockey teams, and it's like groin, glutes, low back, hips, right? So we live in this localized area oftentimes. But then also, like, so you've also worked with soccer. Is this something that you're doing with all programs, or is it like hockey specifically we're really, really focusing on, but this is a general, like, hey, like if you're a high level athlete, like, let's be doing this?
Yeah, I mean, it was really interesting. So I spent 13 years working with DU Soccer, and a couple of years prior to that, at Boston University as a grad assistant, and then again as a full-time assistant for one season, before coming out here. And there are so many crossovers between those two sports in terms of like the hip dominant nature, and just the patterns that you end up seeing, right? So what we see with soccer, right, where I mean, if you see someone that's training within the sport of soccer over a long period of time, you will literally see that they have issues getting their pelvis stacked over their ball of their foot on their they're basically their strike foot, their non-dominant leg. And it's like you can kind of see the same position with a hockey player when they're over their dominant leg, and they're used to finding center of mass in that balanced position. There's adjustments that your hip end up going through, and there's really funky asymmetries related to bottom hand or top hand side. So like top hand on the stick, usually you see upper trap, and really like lat engagement is very, very prominent on that side. And then on the bottom hand, usually you see that shoulder is more protracted and depressed, right? So there's, even by the end of a season, you can see these like orthopedic changes that are occurring. And these athletes have been now on the ice. Most of them are learning how to skate as early as 3-4 years old. And then they have a stick in their hands over that length of period of time, and they get stuck in these patterns. So I think that, to your point, we've seen so much transition that we've started using this pretty heavily across a lot of our teams, especially in the early off-season period with great success, because so many of our sports really are centralized around the hip girdle. And it's like if we can stack, the glute iso series with also going after and using isometrics to, recreate length through their hip flexor, the rec fem, reposition their body and give it, the work capacity and the tissue lengths that it needs to kind of get away from all these compensations in the early off season. We've gotten away from a ton of low back pain or compensatory issues that we've seen over the last 10 years.
Have you ever paired this with any type of like EMG short to see any type of?
Yeah, so Van Dyke did that. I cannot remember for the life of me the company, but we did that like years ago. It was really interesting to watch. I mean, we were messing around with that, with RPR, a whole bunch of other things. So it's really interesting to see. But there is a massive change. Even like I can tell you like anecdotally across, like I bring in freshmen and we onboard our freshmen the summer before their freshman year, right? And they start taking summer classes. They're engaged as a student athlete at that point. And they're usually on site for 6 weeks. And we've had, athletes that have come in with years of low back pain, or have a really tough time with, just even being aware of how their hip should feel and load up as a predominant driver of extension or abduction or external rotation within their stride. And they just feel like they're quad dominant when they're on the ice. So you stack glute isos with all these other things with, really improving biomechanics and position and shape of the athlete on the ice. All of a sudden you start to see pains, aches, compensations go away, and the athletes start flourishing just because they're not experiencing pain and discomfort.
So that company that Sam has worked for, Hunter, What was that called?
It was called Strive, but I don't think they're around anymore.
All right. Sorry for that shout out, Strive. So I think one of the things to tie into this as well, in addition to this glute series, is we talk about like some of the early off-season stuff. Is we've also talked about some of the breath work that you've been doing. And I imagine that this is also part of that early off-season. Like we're doing some glute series isos, but we're also doing some of the breath work. So not this is not an area of expertise for me. I don't think it's an area of expertise for Hunter. I don't want to be presumptuous though, Hunter. I feel like we both know like just enough to be dangerous, but like I think certainly diving in just a little bit more, understanding. Okay, so early off season, we get to campus. Maybe it's a freshman athlete coming in. One of the first things we're doing, I'm assuming, is some of this Glue series, but now also some of this breathwork series. So can you talk us through some of what we're trying to accomplish early with some of this breathwork, these series or whatever you're putting them through, and then what's actually happening from a physiological standpoint as you're trying to go through this evolution?
Yeah. And I'll kind of give a little bit of background because I think like I'm 100% I would never consider myself an expert, but I've definitely done like a deep dive into breath work. Just because it's such a low hanging fruit with athletes, right? So about a year and a half ago, maybe even 2 years at this point, I went down this path of just like getting into Andrew Huberman, Peter Attia, and it's like a natural path. I think as strength coaches age, they start looking into other areas. But honestly, a lot of this time, it's also because of like, maybe you have someone close within your family that's dealt with health issues, and it's the realization that we also need to take care of ourselves as coaches. And, at the time coming right out of COVID, my dad got cancer and I started like really prioritizing my health along with that. And it was one of those things that, you start listening to certain podcasts and I had been exposed to breath work through Dr. Studholme, and what his practice had revolved around. It's really an unbelievable practice because he has a force plate, Neuraxon treadmill, motion capture system. It was really an integrated lab setting for individuals that wanted that level of healthcare. And then he was blending that in with all of his work with the Gray Institute. So it was a really unique setting and approach. And so between the two, it's really kind of led me down this path of like looking into different areas and just continuing to explore my own education and things that support athlete health, wellness, and lifestyle. And I mean, think about it. There's not many other things that we can teach an athlete that they will literally hold with them for the remainder of their life. I mean, if there's one thing that you can say an athlete will do more than anything else, it's breath, right? It's breathing. It's the foundation behind life. And we deal with different things being at altitude. And so there's, I started like really following like Brian McKenzie and what he's done at Shift, which the foundation of what that is and the simplicity of breath work from his end, which is basically teaching, athletes to like gear breathe. Gear one being, when you're completely at rest, is just getting back into nasal and diaphragmatic breath work. And then shifting from there to the upper limits of nasal only, to then going from nose to mouth, right? So a nasal inhale to a mouth exhale during higher heart rate responses. And then eventually getting into mouth to mouth breathing, where you're inhaling and exhaling and you're nearing that VO2 limit. But it's teaching athletes to get away from this chronic over breathing. That's really probably almost every single athlete that we've seen is coming in with dysfunctional breathing patterns. So now what we've kind of done in between that, and you read breath, you read Oxygen Advantage and all these books that do a tremendous job of like layering in just the impact that breath work can do with athletes and honestly with anyone walking around right now. It can make a massive difference. I mean, like I can't tell you how many of our freshmen came in this year and I'm like, okay, like, can you breathe in through your nose or do you feel like you have a deviated septum? And they check one nasal cavity at a time and include the other side and they take an inhale and it's like 70-80% of them are like, yeah, I have a deviated septum. But if you look at the rates of deviated septum, it's like most people think they have a deviated septum, but it's chronic overbreathing, it's inflammation within the nasal cavity. It's other things that are contributing to this like over respiration and chronic inflammation. And it could be things like environmental stress. But I think that we need to do a better job. And I think of getting education improved across, like we can make an impact behind such easy, low hanging fruit that impacts our athletes when they're breathing, impacts them between shifts. So if they jump off the ice, can we get them back into nose breathing? And then think about the impact of what that does across a game and the amount of energy, because they're not just blowing off CO2 and over expiring across the length of a game and going into overtime situations, or the over respiration and chronic issues of breathing and going into bed in those circumstances, and what that does with sleep quality and quantity. People that think that they have issues related to like sleep apnea, and it's usually because they also are repositioning their mouth and their jaw in improper positioning as they go to bed. And so now you've seen this rise with mouth tape and other resources to help guide people through breath work. But I mean, it's something as simple as take your athletes and how many of them can breathe through both nasal cavities appropriately, right? And through these different resources, right, you start to learn that you can do things, and there's like very simple techniques that don't require any resources that can make a profound impact behind dilating your nasal cavity. I think it's the majority of the nitric oxide that your body produces is within your nasal cavity. And so things like humming during an exhale can cause an 8-fold change in nitric oxide within your nose. Which is like, I mean, think about it. You're driving into work in the morning and you're teaching athletes to habit stack or walk, across campus. It's like, hey, just hum a song that you're listening to. You might look weird, but whatever. It's like, you're going to look weird anyway. So you might as well start to learn how to habit stack and make a profound impact behind these different low hanging, impacts behind their health. Right. And it's you teach somebody to self-evaluate between, their normal breathing mechanics or using a Bolt score, which is essentially you exhale naturally and then you just basically hold your breath and you see how long it takes until you get to that first immediate moment of where your body's feeling the need to breathe. And that score is an easy indicator on where an individual is at with their CO2 tolerance and how much over respiration that probably is occurring within their life. And, you get athletes in and they're like, man, my Bolt score is like 10 seconds. It's like we try to get our athletes above 30 or 40, which is hard, right? Like every athlete's coming in with chronic issues related to breathing under super high stress because of the last 15 years of chronic, physical play, or environmental stress with class and other things and social stressors within the college environment. So our ability to take 3 or 5 minutes out of our day during a warm up to integrate breath work in and get them out of those patterns can make a huge impact behind, what they're doing day to day, and even improving sleep going in, before bed.
As you were doing that, I was like trying all the things that you're talking about. I started humming. I just tested my Bolt score kind of. It was like 21 seconds. So when you get an athlete, they try to breathe through their nose. Hey, I can't do it. Their Bolt score's 10 seconds. Like where do you go from an actual, they're under your care, they're within the facility with you. Hey, we're going to do the most regressed, lowest version, easiest version of this breath work that maybe before a training session or after a training session. Like where do you go first to just like get the lowest of hanging fruit?
Yeah, low hanging fruit right off the bat is like teach them how to decongest their nasal cavity. So if you take a natural exhale, so don't change your breathing, but just take an exhale and pinch your nose, and then you move your head up and down side to side until you feel the first urge to breathe. That cycle, you'll start to feel your nasal cavity dilate, and you have an athlete go through that 2 to 3 times in a row, and it increases nitric oxide in the nasal cavity, and you will literally decongest your nose. And even after 1 rep, usually people are like, okay, I can feel the humidity change in my nasal cavity just doing that. And then it's, things like single nose breathing. So you occlude one nasal cavity, with your thumb or your index finger. And you'd basically just teach them to bring air in and out through one nasal cavity. If they find one that's really restricted, you may start at a really regressed number. But even something like box breathing through one nose or one nasal cavity at a time, where they basically go through one full cycle, and it could be something as short as 2 seconds, but 2 second inhale, 2 second hold, 2 second exhale, 2 second hold, and then they switch the opposite side. Or there's different patterns, like 4-7-8, which would be a 4 second inhale, 7 second hold, 8 second exhale. Those are like different sequences, but they're all derived around the same things. Can you increase the length of time during the exhale? And then can you decrease someone's total respiration rate? I think like you'll see that people are just at rest, just sitting there, and they're breathing at an exponential breathing rate. And it's just the breathing mechanics, their upper trap, things like that. And it's become so shallow and chronic across almost every population, that everyone now is just walking around with issues. And it's teaching people to get back into foundational breathing mechanics. It's like, how many people like learn how to walk correctly? It's like you go to a park and you watch someone like jogging or walking, and it's like cringing. Like it's really difficult now as a practitioner to even go into public spaces and see people walking around. It's like you almost have to reteach it. So it's the same thing. It's like, can we get back into foundational movement and teach people these skills that are going to make an impact for the rest of their life?
So I have two fairly incomplete thoughts, so we'll just see where we go from here. First one is, I was listening to a Huberman Lab podcast, and it was about the vagus nerve. And he talks about part of the way that you can regulate the vagus nerve is humming when you exhale, and that it has all these physiological benefits, one of them being, decreased heart rate, decreased respiration, et cetera, et cetera. And it was interesting when I was in Vegas this last summer, and I spoke at that hockey rehab conference, and after I spoke, my Whoop told me that like activity detected. And it was a 40-minute strain that I got from that activity. I was like, that's so, like, I'm just standing up there like talking, but like it detected that activity. And so like I thought about that, and then every once in a while I'm like, okay, let me like try to regulate myself a little bit better and like use some of those strategies. And just anecdotally, it feels like it does do something for me. So now every once in a while, like I'll catch myself over the course of a day. I'm like, let me just see if I can throw like a couple more breaths in where it's like a super long exhale with like some hums. Anecdotally, I think it's great. And then the other thing I was thinking about was like, so when I wake up and I like look at some of my like Whoop score, and I'll see like HRV is 10 today, and then a respiratory rate is super high today. I'm like, okay, not a good combination. But then it's like, okay, well, what do I do with this information? Like, I'm still going to live my life. Like, what do I do with this information? So I guess maybe one of my questions is, are you looking at, I know you just talked about like respiratory rate as something that is important. Is it like an objective marker that you might be looking at for people who do have access to potentially seeing what their respiratory rate is from day to day? And if you could, in a perfect world, create some kind of intervention, and you saw someone come in and all of a sudden, hey, their respiration is, a breath higher per minute than it was the day before, would you have some kind of intervention for them ready to go? Or is it just like, hey, like let's just see where it is over the next couple of days, and if it continues to climb, then maybe we'll do something?
Yeah, that's a good question. And anecdotally, like I can confirm like what you're saying. We, spent a few years using Whoop within hockey and with soccer, the two programs that I was with at that time. And like, I mean, it's really wild. As a coach and as a practitioner, it's like alarming, right? Like I was running, I can't remember, I think it was in the off season during the summer, and I think it was like 4 or 5 different sessions that are operating during the day. And every single one of them was registered as an activity. And you start to see your heart rate. And like when you're coaching and you're in those zones where you're just constantly communicating, that is like over respiration at its finest, right? Because you're constantly talking. So professions where you are constantly communicating, I mean, it could be somebody like a telemarketer, it could be anyone in public eye or communicating at a constant rate. Those things can put people into really bad patterns with breath work. And I think the other thing to acknowledge with what you said is that, it's like, where do you go from there? But it's, when you're breathing, when you get that data from Whoop, remember, it's an instantaneous read on where your respiration's at. And so even taking 2 minutes in doing breath work can shift you out of those situations pretty quickly. But I think it's also being like mindful, being mindful enough to catch yourself. You know, you've just talked with a team, and you know you've gone through a 4 minute spiel, and your breathing's like really dysregulated at that point, and you're over expiring. Then it's like take a second and like shift yourself back out of that. The same way that we're trying to teach athletes that if you just do a shift on the ice, like, and you get back to the bench, can you take a second, blow off your CO2, and then literally like calm yourself down to the point where you're back in and shifting down like a car would into nose to nose breathing. And so it's constant like acute change throughout the day. I think Breath as a book does a tremendous job. And it's the second book that they did with Oxygen Advantage. It's the same author. It's like unbelievable. It's a manual behind almost everything physiologically within breath work. I cannot remember the title. I'll have to look it up. But they even talk about, you know, your ability to shift around during the day and have these moments of going back into normalized breath work, and just the impact that can make chronically across the day. Or even just, you know, can you 100 times across a 1 day period, just do a breath hold, slow your respiration down, and just do a breath hold to re-engage CO2 tolerance and getting away from just constant over breathing. So I think those things, you know, you teach your athletes, you teach anyone around you that's going through these things how to shift in and out, and it changes your energy level. I find that I'm like more calm throughout the day. There's less anxiety or stress that's occurring. It teaches your athletes that through like energy conservation in the middle of their sport. It improves sleep at night. I mean, it's such a foundational thing that impacts, you know, everyone throughout the course of their life. But no one's spending time doing this. And so I think, you know, people like Brian McKenzie and the authors like James Nestor and Oxygen Advantage, like they do such a great job of just illustrating the impact this can make within people's lives.
From a performance perspective, CO2 tolerance is one of the most important aspects of this, correct? Like breath holds and allowing athletes to like deal with more CO2 in their system, because that's ultimately what happens as they are physically exerting themselves. So is breath holding something that you employ maybe at later stages to like build that from a tolerance standpoint?
Yeah, we do it in different ways. So one, it's like even just teaching athletes to like, it's almost like think about going through a square breathing and starting where you're really comfortable. It could be 2 or 3 seconds, but your ability, like let's say every 2 cycles of square breathing, you go up by a second. So you start at 2 seconds inhale, 2 second hold, 2 second exhale, 2 second hold. And then after you've gone through that for 2 cycles, go up to 3, and then to 4, and then to 5. Because think about where you're at from not just like a breath hold perspective, but even just where you're getting to. I mean, like you get somebody down to almost just taking like a 1.5 or 2 breaths across a minute. If you can get them, you know, into that 9 or 10 second range, which, you know, I used to employ before bed, and it was like, man, like I would get myself into the zone where it's like, I could get up to 9 or 10, and there's a little bit of discomfort, which is fine. But it's teaching people that they don't need to be breathing at, you know, 20 breaths per minute. And can you get down into these situations? I think like optimal honestly is just getting down to most people. It's like below like 15 or even 10. But that's really, really easy. So I think for athletes, it's can we get them into these like really, really low respiration ranges, get them to get shift back into a parasympathetic state, and to get away from chronic, you know, stress that they might be getting within their environment, within their sport. And especially, you know, having kids and running around, like these things impact us as we age and as we go into different levels of our career.
You know, it's interesting. Yesterday, one of our guys had a bike, and I had him put his puller strap on. He was like, "Hey, can I just wear my boot today? I don't need my puller strap." And I was like, "Well, just put your puller strap on because it's gonna be more accurate." And he was like, "I don't know. I have the 5. I just bought the 5.0, dude. I feel like it's pretty accurate." So I was like, "All right, like, grab your phone, like start an activity, and like we'll put the puller up too." And it was the exact same for his entire bike ride, and I was fairly impressed. But one of the left turns kind of is, have you ever? And you kind of require some specialized equipment, but have you ever looked at like oxygen saturation of muscle in addition to some of the breath work? Do you have a Moxy right there or something? Nice.
Yeah. So literally, we just got Moxie at late in the summer, so we will be diving into this. Um, but to that point, it's like, you start to realize like the compression that athletes have in different exercises or loading parameters and how that impacts, blood pressure response and it's just like everything is correlated, right? And the way that we program and take athletes across their development, um, really, it's like we're trying to teach people to habit stack as much as we can. Like to me, the most important variable that we're really after is availability. Availability of our athletes to continually lift across a year, to practice, to compete. And the things that impact availability, I mean, like, yes, being a durable athlete is a huge portion of that, but getting people away from mouth breathing and I mean, your nose is a natural filter. So getting people away from mouth breathing and chronic over respiration and improving sleep, which again, it can also be dramatically impacted through breath work prior to going to bed and sleep hygiene and nutrition skills. Like these things, it arguably can make a way bigger impact than, just how much force someone's creating or their ability to deal with all these other areas. So it's like, can we take an athlete and basically teach them, hey, if you're getting sick more than like 2 or 3 times in a year, then we probably need to start taking a look at other areas of your life and whether that's sleep, whether that's your respiration, your breathing, and making a massive impact on those areas. Like we need to do a better job, I think, if we're going to call ourselves like sports performance coaches, of truly tying in these other areas into education. Like we should be lifestyle coaches. We should, help support our sports nutritionists in identifying athletes that need assistance from the nutrition side, environmental stressors that are going on. Like, we're in such a unique situation to be able to tie all this together through the relationships that we have with our student athletes. And at the next level, at the pro level, it's just as important. But it's being able to teach these skills, with a college athlete who wants to have a 10, 15 year like pro career that can truly make a massive impact. And we want them on the ice. We want them to continually lift. And part of that is their normalized health.
Okay, so last actual breath question. I thought the last question was your last breath question, and then we'll get off the topic. Let's say you get an athlete from Illinois as a soccer player, comes to Denver. Do you expect to see like an increase in respiration rate right away because you're now at just a higher altitude? Yeah.
Yeah, 100%. So there's a pretty large difference between obviously the partial pressure at altitude, right? And the higher you go, there's also a difference in barometric pressure. But, there's because of that, it's altering your oxygen's ability to bind with hemoglobin. And as somebody's getting exposure at altitude, right, your body is producing more red blood cells in response to that. So the first like 2 or 3 weeks that an individual is coming out to altitude and they get that initial exposure, I mean, like if you had a Whoop on, you would see a significant change in respiration rate and your base fundamental like heart rate at nighttime. Um, Over time, right, those things change. So the first like 5, 6 weeks that we have hockey athletes out here in the off season period, and the majority of our guys are coming in from sea level, it's like, guess what? Your sleep is going to be terrible. Like you're going to be over expiring. Your respiration rate is going to be increased. It's like your heart rate will be high. It's like you are going to be put into a ringer during that initial exposure for the first half of the time that you're out here. But then as you go, it's like if you continually push fluids, and we also have that combination of being a really dry climate in Denver, that we need to be able to be hydrated and help our body basically deal with that stress. But then you also on the back end get that return of having higher red blood cells. So when we go down to sea level, I mean, it feels really easy to be able to participate at sport at sea level coming from altitude. I don't want to give this away, but like there's teams make irrational decisions related to like the length of time that they want to come in ahead of competition. I'm not going to talk any more than that, but it's there's like decisions that should be made relative to competing at altitude or not. I think, you see University of North Dakota, who has like an altitude room now within their rink and how they're using it. And they have like, the cross campus, the research team that's now trying to help, the athletic department with intervention, which we love to see. That's one of our main competitors and rivalries within college hockey. But it's never going to replace what our athletes get exposure to. I mean, the best case scenario, and I think most of us learn this in school, is that you want to live at altitude and then train at sea level, right? So you get the best of both worlds. Our athletes out here are dealing with a different circumstance.
All these teams just trying to figure out how to beat you guys. I love it.
Yep.
Okay, so second to last question, because we ask the same question to all of our guests. However, very broad, and we'll kind of like shift away from the specificity of what we've been talking about. And I think that like as individuals progress through their careers in this field, it's like, okay, you learn squat, hinge, push, pull, and like that's early intern days, and then you learn about whatever Olympic movements, and then as you go, you're obviously just accumulating more information, and there's always more information coming in, whether you're reading a book or seeing it or talking to somebody. At this point in your career, what's the filtering process that you go through with the information that you digest to decide whether it fits into your methodology? Because at one point you learn the glute layering series, at one point you learn the breath work, and you decided at that point it's worthwhile enough to include in your programming. But I'm sure there's other things that you learn that you're like, well, this doesn't really fit. So kind of like, what's your filtering process for learning new information and deciding if it's going to enter into your program?
Yeah, it's a good question. It's like I've had a lot of like influences over the last 15 years here, and I think like, this goes up almost back to my first internship with Mike Boyle, when I was with BU hockey and when I was 19 years old at the time. And that was my first internship. And it's like our ability to think critically as practitioners, which honestly was like my biggest takeaway. Mike is brilliant at simplifying things down that seem complex. And just really, for him, it's like everything comes down. It's like the old unilateral bilateral debate. Like everyone's heard him talk about like, well, in the end of the day, it's like we just need to make decisions that keep athletes healthy and keep people healthy, and not every exercise is going to fit within that. And so you're always dealing with prioritizations, or dealing with the fact that like we need to make decisions for the best course of action for an individual or for a team. And when you're sorting through this amount of information that's now available out there within our field or external to our field related to things like breath work or nutrition or all these other influences, it has to fit into our environment. I mean, the thing that is the biggest rate limiter within the college environment is time. Our athletes are dealing with basically two jobs, one on the academic side and then one as a collegiate athlete. And we have to teach skills that they can either take with them 24/7. So things like breath work to me are like a very low hanging fruit, because it's like you can do breath work anywhere. You can do it on an airplane. You could do it sitting in class. You could do it before you go to bed. You could do it pre-competition. It requires zero resources. So that fits in very, very seamlessly. Other things that would fit in would be things that are really make a significant impact to health or performance, right? So we're always left with making decisions for the good of the individual and filtering out all these things that I think like really truly it's about what are the low hanging fruit, and not going after the top 1% of performance, but it's like what is truly going to significantly impact health, wellness, performance, availability. I'll use that word again because it's such an important piece of what we do and should be doing. But you have to have all of those things in mind, I think, as we navigate, our communication with our athletes and sharing experiences, because it's the worst thing that you can do is waste someone's time in this environment.
Yeah, I think that's so important, and Hunter and I talk about it all the time because we've done 120 some odd episodes, and that's 150 hours of conversation, which we take away all these things and we're like, dude, like this would be awesome to implement. It's like, oh, we have such a finite time with the athletes that we work with, where it's like, man, we really have to be a sniper with what we decide to actually pursue in those tasks. So
I will
super
say,
super
I
interesting.
will say that I was excited for this episode because, to Mike's point, the glute series and breath work are things that I've rabbit holes that I've like went down earlier in my career, and then they kind of just like fell off the top of my mind, or I didn't really consider them. But I was excited to talk to you because I feel like they are. I think about like the effectiveness and efficiency of things. And it's like if something's going to take 30 minutes, I'm obviously not going to do it. If something fits 15 minutes in early off season that I can add to it, beautiful. If there's a 4 minutes of breath work and I can add, beautiful, because I do think it's effective and it's efficient. And I was excited to talk to you because those are two things that I'm glad I was reminded about them, because it is really low hanging fruit. And especially some of that like glute series, I think it fits so well in the early off season as you mentioned. So I'm excited to dive back into that and try to implement it again.
Well, and Mike, I'm going to circle back here because you asked the question. It's like, what are the first things that you would do with breath work? I mean, honestly, even something as like, hey, if someone's going to do like zone two work on a bike or in the off season, it's like you're running fitness. Like we teach our guys, it's like, hey, you just ran a sprint. How quickly can you blow the CO2 off? How quickly can you go back into nasal breathing? But if someone's sitting on a bike, it's like, hey, can we get them into situations where they're just nasal breathing? And then it's like we looked at the cycling world. I mean, like I told you, I've gone down some weird rabbit holes, but it's like I wear a heart rate monitor, and like you start listening to like Peter Attia's interview with like these the world's best cyclists, and we look at like wattage and output relative to body weight and what these cyclists can do within, I mean, at the elite level of the Tour de France. And you're not even close. And it's like, it just puts people to shame, what they can handle just nasal breathing. And it's like they're at 4 times the amount of like wattage output. And I'm like, what the hell? Um, and so it's like teaching athletes, honestly, like, can we teach them the gear, like Brian McKenzie's gear breathing system? And like, honestly, we're going to be posting that in front of our cardio equipment, just as a reminder to athletes that like, hey, when you're doing like zone two work or you're in a recovery phase between a sprint, it's like shift back down to nasal breathing. Or it's like when things get hard, don't just go from nasal breathing to just mouth breathing at that time. But can you like incrementally increase your gear breathing to the point where you're nasal inhaling and then mouth exhaling, and then eventually get to the point where you need to actually mouth breathe in and out, because of the efficiency that it creates with breath work. So I don't know. It's like the more that you realize that you can teach all these things in all these different avenues and habit stack, on a bike or on an airplane or in all these different contexts, it's like we don't need much. What we need is structure and to educate our athletes and how to utilize these things in different ways. So like literally when I started going through this during the summer, I actually created like just like a quick guide for, our college hockey team and for my NHL guys that I oversee, and literally sent it out. And it was like literally divided by like, hey, this is like the foundations, like understanding gear breathing. Then it's like, this is what you do to, decongest your nasal cavity. And then these are the different breathing routines, the impact that can have in these moments, or how to deal with stress. Like all of a sudden you have an acute increase of anxiety or stress in the middle of gameplay. Like, how do you handle those things? And I think like, I think of like almost pre-COVID or coming out of COVID, you see a lot of athletes that are struggling with anxiety and stress, and just different aspects of the world today. And it's like, can we just teach our athletes how to handle stress differently and get them out of those responses?
My dad, he's a horrible sleeper. Like he'll sleep like he'll go to bed at like 9 o'clock and wake up at like 2 a.m. and like that's it. Like he's good to go. And like he just cannot sleep. And one of his biggest issues with sleeping is he always wakes up and he's like, my mouth is just completely dry, and I have to like chug a bottle of water, and then I have a hard time going back to bed. And so I just one day taught him and just try mouth taping one day, and he was like, I slept from like 10 p.m. to like 7 a.m. He's like, I haven't done that since I was like 30 years old,
Yeah.
and I was, 30 some odd years ago. So, and he's been mouth taping every day since. And he's like, and he has high blood pressure. And he's like, dude, my blood pressure readings have been way better. And he does like other stuff in addition to that. So it's like, it's not like it's the one thing, but he's like so sold now on trying to like regulate his breathing a little bit better, like especially at night, which is obviously just one part of, he has to get healthier and stuff, but super, super cool. So I think, yeah, not only for athletes, but just like what a powerful, just like life tool that people can be doing.
I don't want to
So
publicly say this, but I will. Like I have my 3.5-year-old like little boy. Like I've already taught him how to hum breathe before bedtime. And same thing with my 6-year-old girl. Like I mean, like we literally before bed we will like hum exhale before bed. Like my little boy like literally struggled. He had I think it was like 15 ear infections the first like year of life or first like probably yeah 13 14 months. It was almost like once a month, and he was like chronically like sick, and they put tubes in, you know, right around the 1 year mark, was still probably having some issues, had like adenoid, he was diagnosed with like an adenoid sinus issue. So they basically put him on like a non-medicated spray, nasal cavity spray. And the combination of just dealing and trying to fix nasal issues and like the impact of his adenoid sinus, it like put him in a states where like he was just mouth breathing like crazy. I mean, like you'd walk in the morning and his mouth would be like in his knee, like just gaping wide open mouth position. And he would wake up grumpy and like he was just like off. And so we started like teaching him like literally like, can you shut your mouth before going to bed? And can you like teach him how to hum exhale? And like literally like every day that I've walked in over the last like month since teaching him this, like his mouth is shut. He wakes up happy. He has not been sick in like 4 months now. It's like wild to see the transition. And actually like I think it's in the book Breath. It's either, yeah, I'm pretty sure it's in Breath. They talk about like indigenous cultures, like teaching children how to mouth breathe. And like this has been around for a very, very long period of time, or how to, get back into nasal breathing. And this has been around for a very, very long period of time. There's cultures that literally like they will reinforce nasal breathing from a crazy early age. And they knew these things way quicker than we did. For some reason, we've just gotten out of habits here related to teaching people these skills. But it's made a huge impact behind his health. So thought I'd share that.
Yeah, it's funny you say that because I have a 3-year-old and a 1-year-old, two daughters, and my oldest is actually sick right now. And it's funny how malleable they are because she's sick, she's congested, and because unless we just blow her nose, she's always like breathing through her nose, then she has to breathe through her mouth a little bit. And I always think like, okay, let's say she's sick for 4 days. Those 4 days could alter like her entire subconscious patterns related to breathing, and now she could be a mouth breather. And then you see all those pictures of like what mouth breathers faces turn out to look like, and it's like
Yeah.
I need to she's smart enough now, old enough now to like begin to educate her on like, okay, we need to close our mouth whenever we breathe, because I have noticed that like after this especially she starts breathing louder, and there's just like certain things that happen. And it's interesting when you said that, and it's cool when they get to an age where you actually can start trying some things. So I'm definitely going to try some things with her after we get off the call here. She's
I
gonna be like,
mean,
what
it's
the
like,
heck are you talking about,
especially
Dad?
for a child, right? Like humming and just teaching them how to hum and like doing that before bed, like it's like become like a kind of a fun thing to just do with them, right? Like, you know, it's like it's soothing for them. It improves nitric oxide release in the nasal cavity, gets them into nasal breathing. And it's like if we can improve their sleep and teach those habits at that age, I mean, like, what is that going to do to their health the rest of their lives?
all right, so Matt, we will start to wrap here. We're going to hit you with our very last question that we hit with every guest. We kind of hit with every guest because we just changed the question. So we with the second guest now that we're going to hit with, but everybody else after this. What is, and it's part of Titanium Motion, what is your most memorable moment or story from working in the field?
Oh man. Um, yeah, I mean, like obviously being part of 3 national championships is pretty unique, but I'm actually going to go with probably the 2016-2017 year, just because it was like filled with craziness. So that year, in the fall, men's soccer made a run for the first time in program history to the College Cup. In January, I was named like the NSCA assistant strength coach of the year. Then we won the national championship with hockey that spring. In April, I mean, it was like it was just like a wild ride to experience those crazy highs. And honestly, then it continued on and it's just like nothing ever stopped. During that 2017 national championship, we had like a terrible injury with one of our athletes. And it was like then put right into perspective that it's like I don't even care like about like winning. Now it's just like I want to go back to work and just win another one. And we had this really complicated we had a kid that literally it dislocated his talus on the ice, and like literally his shattered his ankle, like his foot got at full speed got trapped in the corner of the ice and the boards, and he was getting back checked by an opponent at the same time. And so that occurred literally, like, I think it was in the second period going into the third, and it was a really, really tight game, crazy emotional swings going on. And then that summer, we literally, I mean, he had his reconstructive surgery on his ankle, then had to get a second surgery, towards the end of the summer. And we literally, I mean, it was probably the coolest and most challenging return to play case that I've ever gone through, because we literally had to like reteach him how to skate with one ankle with almost zero ankle dorsiflexion, and the mechanics and the hardware limitation on that side. And he returned, he only missed 2 weeks during the next year or 3 weeks of the next year, was our captain the following season, and literally is still playing professional hockey and ended up playing in the AHL and then overseas and is still playing, almost 8, 9 years later. So it's like just absolute wild ride. But that year, and then I ended up getting married that summer too. It was just like, oh, let's just throw all these things together. So it's just, I think like you never know what's going to happen in any given year and just the ride that you're going to go through, but just really appreciate all those experiences. They all hit simultaneously and for the good and the bad. But just really really appreciate I think just going through all of that in a 12-month period.
That's nuts. And one thing that I've thought, and I haven't spent anywhere nearly as long as you've been at Denver, but it's really cool to talk to individuals that have been at one stop for a while, because you're there's so many experiences if you move around, but like to establish yourself at one place and have all these different experiences and win these national championships and work with different teams. And I'm sure you're one of the more longer tenures of most people within the athletic department at Denver, which is probably really cool too, because you've seen a lot of shift and move. So it's very cool to hear stories from somebody that's been around at one stop, because it's not very common in our field.
Well, and I think to that point, like, and this is maybe a shout out to all the younger strength coaches listening, like there is value in not jumping around and chasing logos or the name of the institution. Create value where you're at. When I got to Denver, I didn't even know much about Denver when I took the job here. And I knew that it was like really raw and had great resources and a great athletic department, kind of did that background, but I didn't know what it was eventually going to turn into. And, I've had opportunities to move to the NHL and have turned them down, because of how much value that and support that we've gotten here, as a department, and especially in today's circumstances of really the NCAA's completely flipped up on end, right? Like between NIL, rev share, and everything that's going on, we have the ability of creating value that's unique, and Denver is a developmental institution across every single one of our sports. Even hockey, I mean, we get one first round draft pick every few years. The year that we beat Michigan in overtime in the Frozen Four to then go to the national championship game, they had 5 of the top 10 first round draft picks. And it's like, for us to beat them in that moment on a team that was arguably like looked to be like undefeatable. I think those, and we did it, I think that was the year that we had 10 freshmen. And it's wild to kind of see the impact that you can make. And just like, I find so much value and just like love being here because of the challenges that we go through, and the unique settings that we go through here at DU as a very small private mid-major. But we know who we are. And it's like what you can do as a practitioner in this type of setting. Like, people need to not jump around so much, and to create value where their 2 feet are at. And if you do that, good situations happen. So I'll leave it there at that.
Yeah, I think it's like a testament. I've always said, like, don't mess with happy. And I think that you get to a situation and you're happy, but it's like, well, this isn't the level I expected to work at or wanted to work at. And it's like, well, if you're happy, you probably don't want to mess with it too much. But uh, sounds like my daughter's about to break the door down, so I think we can end it there. But Matt, thanks for your time, man. This has been I've known about you for a while, so I'm glad, and we had the opportunity a couple years back to have a conversation about a position at DU, which didn't actually come to fruition. But thank you for your time and chatting with us.
And
Yeah.
Matt, real quick, if people wanted to find you, reach out to you, where could they do that at?
Yeah, I'm basically only on Instagram at this point. Hang on, I gotta even check what my handle is. I think it's Shaw_sports performance. Or they can just honestly just reach out. Pretty accessible via email. Matthew.shaw@du.edu. Happy to answer questions. But honestly, the other shout out would be like, check out our fellowship. I mean, like, our fellowship is literally designed around younger strength coaches that are usually postmasters that like want to get this type of experience, that want to be shaped in this way, and exposure to sports science, exposure to all these different areas. It's a pretty unique education setting. So check us out.
Awesome. Well, appreciate your time, Matt.
Yeah,
We'll
thank
let
you.
you get out of here. And yeah, thanks for this.
Yep. Appreciate it, guys.